Hello, everyone. Welcome. Thank you for joining us for this webinar on leveraging health sector programs to accelerate progress in maternal and child nutrition. I am Wubish Afloha, Senior Global Nutrition Policy Analyst with World, and I will be moderating this event. I hope that wherever you are, everyone, wherever you are, is safe and staying well. I know that everyone is engaged in this battle to end malnutrition in different ways. So we are grateful that you chose to be with us today in this discussion. This event is part of BREAD's Better Nutrition, Better Tomorrow campaign webinar series. And I am thrilled to be joined today with Ms. Kelly Stewart from USAID Bureau for Global Health, Dr. Islam Bulbul from Ministry of Health and Social Welfare, Bangladesh, and Mr. Hajar Maalim, Action Against Hunger, Horn and Eastern Africa region, to explore really important issue, how essential nutrition actions can be effectively integrated within the health sector in all settings to help protect mothers and children against malnutrition and accelerate global progress on improving maternal and child nutrition. Even before the COVID-19 pandemic, we know that nearly 1 in 3 people around the world had at least one form of malnutrition, and based on current trends, this number is set to rise to 1 in every 2 by 2025. Malnutrition is the leading risk factor for deaths in children globally, accounting for 45% of all child deaths, yet these losses are almost entirely preventable. Addressing the challenge of malnutrition in all its forms requires multi-sectoral actions, including in health, agriculture, social protection, WASH, education, and other sectors. But major global impact can be achieved if high-quality nutrient services are provided to the people as part of health systems. According to the WHO, a stronger focus on nutrition within health services could save 3.7 million lives by 2025. Now, due to COVID-19, the world risks backsliding nutrition gains with irreversible impacts on mortality and lost potential. Initial projections show likely significant increase in wasting and mortality caused by it. Many countries, around 52% according to WHO, reported disruptions in health and nutrition services for sick and malnourished children. Field reporting also indicates significant reduction in coverage of key nutrient interventions. We know that these will all translate in loss of life and decades of development gains if not tackled with adequate action on nutrition as global decision makers focus on response and recovery. As we are both in the middle of the COVID-19 pandemic and the UN Decade of Action on Nutrition, this is a historic opportunity to adapt, reimagine, and invest more to accelerate action on nutrition and transform health systems towards better integration of nutrition actions. In today's webinar, we will explore how these nutrition actions can be effectively integrated within the health sector programs and improve access to key interventions, including management of acute malnutrition, vitamin A supplementation, providing iron and folic acid supplements as part of antenatal care, promoting, protecting, and supporting optimal infant and young child feeding practices, nutrition counseling, and other interventions. A few housekeeping items before we begin. We will have speakers share their remarks for about 10 minutes each. Then we will have a short Q&A session. If you have any questions now or during the presentation that you would like to ask the panelists, please submit your questions through the chat box. We will monitor the questions as they are submitted, and the panelists will respond to them at the end of their presentations. This webinar will be recorded, so we will be able to share the link for the recording tomorrow. You can also take part in the Twitter conversation using our nutrition community famous hashtag #InvestInNutrition. We have an exciting program lined up for you, and without further ado, I will call on our first speaker, Kelly Stewart. Kelly Stewart currently serves as the chief of the Nutrition Environmental Health Division in the Bureau for Global Health. Kelly has been with USAID for over 20 years, working both in Washington and in the field. We at BREAD have been working closely with Kelly and her colleagues. She has led efforts on a broad range of development and emergency response programs, including multi-sectoral nutrition, health system reform, and strengthening maternal and child health. Kelly started her development career as a Peace Corps volunteer in Guatemala and Honduras. She has a BA in sociology from the University of California, Santa Cruz, and an MHS from the Johns Hopkins Bloomberg School of Public Health. Kelly will speak to USAID's global health investments, including its acting on the call report to integrate nutrition at scale through its health programming, including its response to the COVID-19 pandemic, and understand USAID's priorities for nutrition post-COVID world. We are grateful to have Kelly with us today, and I will now turn it over to her for her remarks. Over to you, Kelly.
Okay, thank you very much, Wabishet, and I hope that you can hear me and that all the participants can hear me well today. Thank you so much for the warm welcome, and thank you to Bread for the World for the invitation to speak with you all today about USAID's commitment to preventing and treating malnutrition around the world. And I'm thrilled to be joined by my fellow panelists to talk about this very important topic, which, as we know, is becoming more and more important each day. So I'm going to go ahead and move on to my next slide. If I can do that. There we go. Perfect. Okay. So just to recap a bit and to draw on some of the things that Wabishet mentioned in his opening, why do we invest in nutrition at all? And to reiterate his important points, undernutrition contributes to 45% of under 5 child deaths, and it also has a significant impact on cognitive and physical development of children. But at the same time, we know that undernutrition and malnutrition is preventable. And we really do have an obligation and a commitment to prevent undernutrition in children, both to save lives, but also to ensure that children can thrive. The COVID crisis has only further emphasized the critical role of nutrition in the resilience and well-being of families and communities. And we know through a new analysis published in The Lancet by the Standing Together for Nutrition Consortium that the estimate that wasting could affect an additional 6.7 million children in 2020 as a result of COVID-19. USAID maintains a very strong commitment to nutrition as a priority in meeting our health and development objectives. And also, as we battled the spread of COVID-19 and its effects, it is our firm belief that that projections are not destiny, and that by working together, the global nutrition community can meet this challenge. So let's talk about nutrition in the health system. Building capacity to deliver nutrition in the health system is vital to preventing maternal and child deaths. Our investments support the integration and strengthening of nutrition as part of a basic package of services at the facility and community level. And I really want to emphasize the importance of working at both levels. We cannot address undernutrition at just one or the other. And we know that the work at the community is so essential in having comprehensive and high quality care for women and children. Our nutrition priorities in the health system focus on the 1,000-day window of opportunity from pregnancy through a child's second birthday, a period in which good nutrition is critical for optimal physical and cognitive development. This work includes several priority actions, including exclusive and early initiation of breastfeeding and complementary feeding practices for infants and young children, promoting comprehensive and context-specific social and behavior change interventions, improving management and prevention of wasting, scaling up vitamin A and micronutrient supplementation, strengthening coverage of supply chains for essential nutrition commodities, and protecting optimal maternal nutrition with nutrition, counseling, and supplementation for pregnant women. As many of you are aware, USAID released its annual Acting on the Call report in July of this year, in July of 2020. And the Acting on the Call report has served as a roadmap for accelerating progress against one of the agency's top global health priorities, preventing maternal and child deaths. This year's report highlights how far the global health community has come in accelerating access to essential healthcare for mothers, newborns, and children. I'm pleased to share that with the bipartisan support of Congress, USAID investments continue to prevent maternal and child deaths and deliver results. In 2019 alone, USAID helped more than 84 million women and children access essential and often life-saving care. Additionally, USAID reached more than 27 million children with essential nutrition programs last year. In honor of the International Year of the Nurse and Midwife, the 2020 Acting on the Call report recognizes the central role that nurses and midwives play and underscores that sustained improvements in maternal and child health and nutrition will not be achievable without increasing the volume and equitable distribution of health providers. This includes ensuring health workers at both the facility and the community level have the critical skills needed to provide high-quality nutrition services. USAID investments support governments and the private sector to develop the health workforce that is sufficient in size and is accessible to every individual. For example, in Malawi, USAID helped 5 hospitals achieve baby-friendly accreditation, which means that they provide the information, support, and skills that new mothers need to breastfeed their newborns, and helped 10 additional hospitals maintain their baby-friendly status. In Mali, we coached more than 1,800 frontline health providers, including nurses, midwives, and medical doctors, across more than 800 facilities on the provision of high-quality maternal, newborn, and child health care and nutrition. Now, more than ever, we need to step up our efforts on nutrition. Now is not the time for complacency as countries around the world combat COVID-19. The pandemic has resulted in widespread disruptions in essential services and in food systems that have profound impact on the ability of families around the world to nourish their children. For example, producers and sellers of nutritious foods are struggling to stay afloat, health systems are overwhelmed, families are reluctant to access needed services. Efforts to stop the spread of COVID-19, while very necessary, have an impact in access to life-saving care in some cases. Misinformation and reduced support make it harder for mothers to breastfeed, and social safety nets are struggling to expand to meet growing poverty. Because nutrition is bolstered by both health and food sectors, the global community's response must address both. USAID is coordinating a response that ensures nutrition priorities are addressed now and sustained once this pandemic subsides. In the health sector, we are focused on leveraging efforts to strengthen and rebuild health systems, including community health worker platforms, to ensure the delivery of nutrition services through routine maternal and child health platforms. As a result of the COVID-19 pandemic, our staff and partners are working tirelessly to pivot our programs to ensure the provision of essential nutrition care while following recommended practices to limit the spread of COVID-19. For example, in Nepal, rapid remote monitoring tools were employed to assess the stock of essential nutrition commodities in health facilities. Programs used alternative transport to deliver commodities where transport systems were shut down due to COVID-19. In Zambia, access to nutrition services are being ensured through strong community health worker platforms to meet the needs of children and families. To continue support for nutrition, USAID programs have disseminated key nutrition messages in local languages, video, phone, and PA systems to support pregnant and lactating women. Use of technology has been expanded through the development of virtual platforms for remote training and supportive supervision. At the global level, through USAID's Advancing Nutrition Project, we are supporting COVID-19 related adaptations to the widely used UNICEF Infant and Young Child Feeding Counseling Card Package to ensure that healthcare workers can continue to provide nutrition counseling to support mothers and caregivers to feed children in a safe and healthy way. In order to safeguard the progress made in reducing rates of malnutrition over the past few decades, the global nutrition community must continue to collaborate across sectors and work together to ensure access to nutrition services for the most vulnerable. Moving forward, USAID will continue to focus on protecting and expanding access to priority nutrition interventions in the health sector by mobilizing domestic and innovative resources for nutrition, enhancing quality of care of health services by conducting implementation research to assess and improve key nutrition components, advancing the use of systematic design, implementation, and monitoring for high-quality SBC, promoting breastfeeding counseling during antenatal and postnatal care at facility and community levels, pre-service training for nutrition for healthcare providers, and counseling for child nutrition during well visits and sick child care. And finally, supporting better global estimates of nutrition deficiencies, contributions to morbidity and to poor development for children, and optimizing interventions across food, health, and humanitarian response systems. We will also continue to work to improve data collection for nutrition and to strengthen countries' health information systems to ensure effective monitoring and evaluation of nutrition programs. Finally, I want to emphasize what all of us know, which is 2021 is definitely a make or break year for nutrition. USAID is very excited about the year to come and for the opportunity for all global partners to reiterate their strong commitments to accelerating progress on nutrition. In the year ahead, we have many big moments on the horizon for the global nutrition community that USAID is looking forward to supporting and engaging in, such as the Scaling Up Nutrition Strategy 3.0 rollout, the UN Food Systems Summit, and the Nutrition for Growth Summit. We are committed to working with the global nutrition community to prevent the legacy of this pandemic from becoming a generation of children who lose their lives and future potential to malnutrition. Thank you very much.
Thank you, Kelly, for sharing. Thank you, Kelly, for sharing the USAID's incredible work and reach in different parts of the world. I want to thank you also for emphasizing the importance of investing more in nutrition and sharing the agency's future priorities. I agree with you. I think 2021 is really important year. So our next speaker is Dr. Islam Bulbul. Dr. Bulbul is a Deputy Program Manager, National Nutrition Service and Technical Support to Scaling Up Nutrition, focal point at Ministry of Health and Family Welfare in Bangladesh. As a member of Bangladesh Civil Service, Dr. Bulbul was extensively involved in the process of formulation, from development to endorsement of second National Plan of Action for Nutrition. He regularly represents government of Bangladesh in national and international stages. He's a medical doctor by training and has MPH from James P. Grant School of Public Health. Dr. Bulbul will deliver remarks on national government leadership on nutrition, how the country adapted to the crisis and opportunities for new, stronger national health systems for nutrition. He will also speak on role of partners, including donors, advocacy community, multilateral organizations as the country strives to achieve 2025 and 2030 nutrition goals. We are really grateful that Dr. Bulbul is here with us today. Over to you, Doctor.
Thank you, Shit. Can you hear me? I will actually speak on our national activities. Here we have did on behalf of government of Bangladesh. You already learned that nutrition is very much important component from my previous colleague Kelly already mentioned that this is really important determinant of physical growth as well as cognitive development. and also this is fundamental to achieving the optimal health for and most important to fight against COVID-19. Also, to fight against the COVID, so those who are undernourished or weaker immune system, they might have greater risk to the severe illness. So nutrition is really important. Also, another way, if we consider that 1 in 3 people across the globe actually suffers from any type of malnutrition, and also a big number of children are stunted globally. Finally, big number of children are underweight, and globally 2 billion adults and 41 million children are overweight or obese. So this is very much important. Also, nutrition is called the heart of SDGs. So there is linkage with almost every goals, either directly or indirectly with the SDGs. So I will now focus on our policy activities. In our country, Bangladesh is really well ahead to formulate different types of policies, and according to policies, government has taken a lot of initiatives to improve the nutrition status of people. After independence, since 1971, in 17.2, we have actually constituted our article, and that article we have well articulated the importance of nutrition, and state shall actually focus on the nutrition and ensure the nutrition of the population. Then we have developed several nutrition policy, as well as different type of Food Safety Act. So we have Vision 2021. We have 5-year plan. We have National Nutrition Policy 2015. And finally, we have Plan of Actions for Nutrition. And we try to bring all the relevant ministries, relevant agencies to work together to improve the nutrition as a multi-sectoral approach. Since our independence, we are trying our best to improve the nutrition status. I actually try to show one picture, very good picture. If you consider about 1970 or 80s picture, and also after 2010 picture, so you actually see the changes of our children, how we actually progress. If you consider about stunting, underweight, and wasting, and also global 6 target, global target of nutrition, also the SDG, Sustainable Development Goal, we are actually in the align with our targets, as well as in our trends. That stunting, we came from 43% in 2007. Now it's 31%. Also underweight as well as wasting. So if you consider about the comparison between the CRO as well as the global average, so still we are in a good position since we had a lot of burden since our independence. But fortunately, by our production and all these things, we and our activities during the nutrition services, so we have came up with the stunting, wasting, and overweight. If you see the progress, actually we have dropped 28% in stunted children within 10 years, and 46% drop underweight, and 53% drop in wasted children. If you consider about our production, so we are 4th largest rice producer. We are also, 3rd largest vegetable producer. Also, we are 10th largest food grain producer in the world. And every year, we improving high-yield rice varieties. And since 2009, still we have yielding new 109 high yielding rice varieties. If you consider about the food grain production and all this production, we have improved, as well as fisheries, livestock. So every sectors in the production we have improved, and people are actually utilizing this production actually to improve their nutrition status. Finally, if we consider about the consequence of COVID-19 pandemic and the current scenario, then this is very much tough for us to actually consider on the issues of COVID-19 as well as our people's status. So government has taken a lot of initiatives to improve the situation, especially to ease the economy as well as all the things. So it actually hit our economy. Also, with the 2 months lockdown, increased the poverty rate. Also, it stricken the poverty during pandemic, income, earnings, as well as all these things like any other countries of the world. So if we consider about what response actually we did, we have a very good leadership of our Honorable Prime Minister. Actually, she has actually given us the order that every inch will be cultivated during this COVID situation. So production must be ensured, as well as people must be well aware to utilize this production so that they can get proper nutrition and they can save themselves from this COVID situation. And also the role of national nutrition programs. So every programs was actually continued during this lockdown and shutdown period, so that people must be ensured proper nutrition. And thank you very much to our donors and other partners, the UN organization, international agencies. They also supported us, the government, by their different plans, different policies, as well as strategies, directly, indirectly. And you'll be happy enough to know that UN actually developed a framework for the immediate socioeconomic response to this COVID-19 situation. Also different agencies like even USAID, they have taken a lot of initiatives like improve the agricultural production, livestock. Also, they focus different under nourished geographical area. Like one example I can give you, like Bani, that is Bandarbon Agriculture Nutrition Initiatives. So these types of initiatives actually help us to manage the COVID-19 situation very well. Due to this COVID-19, also our production level, like the fortification and all these things, whatever the production level was less, also we encourage people to improve the situation. So I will also share two things. One is how we actually did to ensure food security, and another one is improve the nutrition. So government actually make some stimulus package, also waive the tax, as well as ease the letter of credit margin for essential commodities, as well as prioritize the customs clearance so that we can actually make proper movement out of food, feed, and allied products. Then we have improved the storage facilities during this COVID situation, and finally arrangement of food transportation. However, government took a lot of initiatives to improve the nutrition during this period. Like we have developed a projection model that what might be possible malnutrition burden during this COVID-19 period, and we have reviewed the situation and what might be the impact. Then National Nutrition Services actually prepared set of nutrition package for this COVID-19 situation. Then government has enhanced countrywide social protection programs. Then develop some nutrition sensitive food package during this emergency. Government encouraged to include local production in the relief package, because we have observed that people are produced, but they could not able to sell it in good price. So we actually encourage the government official to and also the local label, the politician, to include the local production in the relief package. Finally, we use several types of innovations and try to utilize our volunteers in every sectors to manage this COVID situation. This is one example I am showing you, that very recently we have just finished our vitamin A+ campaign, and we try to maintain the social distancing as well as all the format, and fortunately it was one of the successful programs during this COVID situation. This is one actually the IC materials, that is information, education and communication materials, how people could get better nutrition. And finally, we have a lot of challenges and we have the way forward. We have prioritized to prevent hunger and malnutrition. Also, we have better better effort to build equitable, resilient and sustainable food and health system, because the bridging between food and health system is very much important with a multi-sectoral approach. Then strengthen coordination, alignment and financing. So invest for nutrition is very much important. Develop a comprehensive food and nutrition security plan. Government is trying to protect and strengthen ongoing programs so that nothing would be hamper the COVID situation. We are focused on poor and new poor and gender, so that geographical coverage also be ensured. Also, we are trying to encourage farmers, the food systems and food suppliers to make better supply so that people can get better nutrition. At last, support the small and medium enterprises to ensure the nutrition security, and finally build awareness so that people can produce as well as utilize to improve their nutrition. This is all about my presentation, that what Bangladesh has taken during this COVID-19 situation, and also total overall nutrition activities. So thank you very much for hearing me, and I am really happy and honored to be here, speak as a panelist. Thank you very much.
Thank you, Dr. Bulbul, for sharing your insights, for noting that nutrition is at the heart of SDGs, and it's really it's impressive to witness the progress Bangladesh has made, as well as response efforts and challenges due to COVID. Now we will hear from Hajar Maalim. Based in Nairobi, Kenya, and Hajar Maalim serves as Action Against Hunger's Regional Director of the Horn and Eastern Africa. As one of the organization's strategic and programmatic leaders, he supervises 6 country directors in the region. Mr. Maalim has 15 years of experience as a humanitarian and development professional. He also served as country director for Action Against Hunger in Somalia and in Yemen, in other roles in Djibouti, Ethiopia, and Liberia. I have known Hajar since 2012, since the time we worked together in Yemen humanitarian response. Mr. Maalim earned a Master of Science in Civil Engineering, specializing water and environmental management from Loughborough University in the UK. He also holds a Bachelor of Technology in Civil and Structural Engineering from Moi University, Kenya. We look forward to hearing from Hajar on the impact of the COVID-19 pandemic on nutrition programs and how the organization adapted to the crisis in community-based health and nutrition programs. And he will help us understand lessons learned for moving forward. Over to you, Hajar.
Thank you, Chet, and thank you all the participants for joining us today to our conversation around nutrition issues. First, I will start. I will start with having a voice from a community. We talk about numbers, millions of people in need, tens of millions of children at risk. And I think these are people, so I think we need to first give them the recognition that they need and to have them as well as speak. So I'm going to use the voice of a mother from Oromia region in Ethiopia. She lives with a husband and 6 children, and she does plant crops and keep livestock. This is clear representation of the household profile of the communities that we assist, the communities that are facing the brunt of malnutrition. Average household sizes tend to be between 5 to 7 members, and they tend to do a lot. I mean, you can see from this mom that they do 2 types of economic activities. So they tend to diversify their livelihoods, understanding that they're facing a lot of risks and shocks in the communities where they live. And therefore, they make efforts to live the life that they desire. And they make effort. They're not, when we talk about aid and the recipients of aid, these are not people just sitting, waiting for assistance. They're doing everything they can to be able to withstand the shocks that they face. Now, looking at the next statement from this mom, saying that when I go out to fetch water, I take my children with me, clearly indicates the level of pressure and responsibilities that they hold. Mothers have, let me even say, quadruple role as a spouse, as a mother, a caretaker, sometimes even, as breadwinner, and often sometimes as even a teacher as well. Multiple roles. And gender inequities is a key drivers of vulnerabilities and a key causal issue for malnutrition that we face in many of these communities. We also see a significant number of households that are female-headed. 30%, according to one assessment, in some countries, we have 30% of households are female-headed, and we are also seeing that these numbers even increase significantly when you're dealing with displaced population, because that's majority. For example, if you look at the South Sudanese refugees that have been displaced to Uganda, majority of them, 80% of people are women and children as well. If you look at the next statement from, okay, I'm just hoping that this will move. Okay, let me see. Yeah, we sell our livestock during dry season, but apologies for that. Let me just go back one slide. So the statement, we sell our livestock during our dry season, but livestock prices have gone up so much. Trying to get back. Okay, apologies. Okay. So clearly indicates that, particularly I think the vulnerabilities that they face as well, but you can see also it's also the impact of COVID-19 as well. What we have seen is the impact of seasonality, and this has an impact as well on prevalence of acute malnutrition. I mean, of undernutrition as well within these communities. It has an implication in terms of the way we respond as well. So the cross-border trade disruption, the outbreak of these livestock diseases, for example, the impact of desert locusts combined with the impact of COVID-19, clearly it's having massive implications on these households' capacity to withstand all these multiple shocks. Some of the communities that are facing these challenges, you can see a price change somewhere in the world has massive implications because these households are dependent on imports. Finally, I think clearly the implication of COVID-19 is on social interaction. And we see this is significantly very important, particularly for women leadership, particularly for engagement. I think dealing with all the, when we're talking about societies, I think the integration of it is critical. And this is very, very important in terms of having an implication downstream on the nutritional status of the household as well. But just moving to the disruption caused by COVID-19, and talking a little bit about the challenges that we face. Disruption is the main concern of COVID-19. So nutrition services and health services have been significantly disrupted. We have seen, for example, private healthcare providers that are also substituting some of the services that cannot be provided by the stakeholder like the government closed shop as soon as COVID-19 hit, and therefore these have massive implications on access issues, putting strain on existing functional facilities that are run particularly by aid agencies or the government. We have seen as well performance of the nutrition program dropping in some areas because of default rate. And you can understand that access was limited because of the measures that have been put in place to control COVID-19. However, we are facing, and I think many of you in the room do understand the challenges related to access and availability of services. I mean, health and nutritional services are quite limited in many of these areas where we work. And where the services exist, many times these services are disrupted because of the lack of essential therapeutic products. I mean, the picture you can see on the right of the screen is a clear demonstration of the challenges that we go through to provide these products to facilities that are in very hard to reach areas where access transportation facilities are sometimes non-existent. Now, having pictured these contextual issues, just to quickly go to discuss a little bit how the COVID-19, how we've introduced new ways of working in relation to COVID-19. First, it's moving one slide faster, so apologies for that. Okay, yeah, here. So, okay, fair. So, choose. All right. Oh dear. This is. Let's just go back one slide. Yeah, here it is. So the question about locally driven solutions is important. I think the mantra, I mean, it's not even a mantra, but it's the key operating principle for us is that mothers can do it too. What we have seen is by giving mothers a more tip, they can be able to detect malnutrition quite very early. And this came in handy when it came to COVID-19 because the provision of services moved from facility or from a community-based approach to the household level. So mothers having that, not only that skill, but the resource to be able to use a simple tape to be able to diagnose and detect the malnutrition status of the child and therefore seek early treatment. It's amazing. It's a simple thing. Sometimes simple solutions are the most effective ones. And we've seen that massively work during COVID-19. We have seen government, for example, adopting family work approaches, which sometimes people have questions about it. Family work is when our mothers can be able to detect the malnutrition at the household level. This being scaled up significantly due to COVID-19, given that community-based or facility-based services were disrupted. This was critical because this results, first in one thing, is that early detection, therefore you don't find children when they're significantly deteriorated. And secondly, is that it actually saves money. When you find, if you detect children early, it takes less to treat them from acute malnutrition. The second key thing that has been brought about by COVID-19, I think that's actually been boosted as well, is the development of local capacities. I think, and this is actually driving as well exit strategies. I think we have seen, I think COVID-19 assessed the system and clearly demonstrated the capacity of the local structures. So let me just take an example of in Ethiopia, for example, in one of the hard to reach areas in Oromia, in Hararge region, in Hararge zone, we had in 2 districts, difficult to access, poor availability of services, and the quality of services is poor. What we have done using simple technology like WhatsApp and having health workers in those facilities send pictures of them doing their work, them sending pictures of their reporting that are handwritten, and then this is shared with a larger group of experts who are located hundreds of kilometers away and providing regular feedback. We've seen this significantly improve uptake of services and improve even quality of reporting. Our initial assessment clearly indicated that in these particular areas, we were able to increase access from the initial 77% to 92% in 2 districts. Simple technology, Why was it not being used prior to COVID-19, you may ask? But I think clearly, I think we were tested, and this has clearly demonstrated that simple solutions can work, and we have used them effectively to improve access to nutrition programming. And then in terms of COVID-19 response as well, there was initial panic about COVID-19. Many of us didn't understand it and how it will impact the health system, how it will impact the nutrition situation. We had to reinvent invent very quickly and adapt, and therefore, as a provider of last resort, also deal with COVID-19 using existing health and nutrition infrastructures as well. Just quickly, just to demonstrate a little bit more the general principles in the way Action Against Hunger work on health and nutrition issues, but also just, I think this is also representative of the way the cluster, the sector of health and nutrition work, is that the key point is the system strengthening part. We need the system to work effectively, and the systems have different levels. In some situations, using the 3S model, we substitute because it's essential for life saving, and it's critical that our assistance is provided now, and this is injection of capacity by an international actor, for instance, providing that assistance. There's the areas where the support is provided. For the facility to run, you just need, for example, to fuel the vehicle for that facility, and they can be able to operate effectively, or the generator for the facility. A simple resource injection like that will make maximum impact as well. And then in other areas where particularly towards transitioning toward exit, where we strengthen the system for the long term as well. It's very critical when doing responses is to have a very good understanding of the situation, much more localized at the facility level, much more localized to communities to better understand the nuances of these. And nutritional assessment is also resulting into other much larger response beyond even direct as a response to nutrition programming. And finally, let me just emphasize a little bit the last point. We all talk about, and in the numbers you have seen, we talk about coverage of nutrition programming that is very limited. If we all double our efforts, each one of us, if we are treating 2 children today, or if we're providing funding to treat 2 children today, if we make an effort to make it 4, this doesn't mean you double the amount of money you give sometimes. It's about finding solutions that are cost effective and be able to reach more with a little bit of more additional resources, not really doubling in terms of resource injection. At Action Against Hunger, for example, we ask ourselves the question, we have millions. I mean, in the region, for example, we have 4.8 million acutely malnourished children, majority not accessing treatment today. What can we do as Action Against Hunger? How can we be able to be effective in responding to these? And the first commitment we did is to say we will double our reach. And we're doing this through very creative ways. First, through research, making sure that we find much more cost-effective ways. Second, is mobilizing communities. Communities have huge resources that they bring to the table, and finding other creative ways of addressing the problem of acute malnutrition and nutrition overall. Let me just end the presentation by just talking a little bit about a case study of South Sudan. In South Sudan, many of you are familiar with the context there. It's a very difficult context to operate, very high levels of needs and the difficulties. The complexity of existing vulnerabilities compounded by the additional issues related to COVID-19. So through the generous funding of USAID, we are running a nationwide programming that works in very difficult areas, hard to reach areas. And how do we work in this programming? What we do is, through assessment with the nutrition cluster, we identify a location where there are no actual presence and there is an escalation in the levels of need. So what we will classify as a new crisis within a crisis. This is prioritizing, making sure the dollar goes to the most vulnerable. So we know, I mean, this large, I mean, half of the country is in need, but within that half that I need, there are those who need more assistance right now than others. So this programming is targeting the most vulnerable in the very high priority areas. But the beauty of this programming is that when we go there as Action Against Hunger, we're not going to go there and stay there. What we do is we have a 3-month plan where we work with, we identify a local actor, build the capacity, work with them over a 3-month period, and exit. Our surveillance and evaluation teams, they closely follow up this partner, ensuring that that capacity continues to exist, continue to provide that assistance as we move to a new area where there's a new need identified. This particular programming has had massive impact. I think it's about using effectively the limited resources we have to gain maximum impact. But what is very, very important is that also the injection of resources and capacity that might be needed to turn the tide against the problem of acute malnutrition. Though if you look at the numbers and the resources asked, sometimes they look insurmountable, but I think it is something that can be done. If we can be able to do this, and this particular programming wasn't even disrupted by COVID-19 when there were limitations in movement, we were able to find creative way around all those challenges to continue to provide that assistance. And that is how we can be able to change the tide on the problem of acute malnutrition and reach the goals, the sustainable development goals that we have in terms of dealing with hunger overall. I will end by re-emphasizing the last message, which is that let's all double our efforts. We can do this. Thank you very much.
Thank you, Hajar. Thank you for your insights on the work ACF does, and also for sharing that touching story. I think we have a tendency, to get carried away with numbers and forget people. Thanks for reminding us. Impressive innovations and new ways of working. You noted locally driven solutions. It's really impressive to see mothers being able to detect malnutrition at home and refer. Thanks for emphasizing on simple solutions as well. I think we are running out of time, but I just want to thank you all the panelists for sharing your insights. We have a few questions from the audience that we received during the registration, so we will try to go through those questions quickly. So the first question I will just pose to Kelly. What are some compelling ways to demonstrate to members of Congress that we need U.S. leadership on this issue? And along with that, what messaging works most effectively to engage decision makers on these issues? Kelly, over to you.
Sorry, Wubsha, you broke up. You broke up at the last part of the question. Can you ask the second part of the question again?
Yeah, sure. What messaging works most effectively to engage decision makers on these issues, on nutrition issues?
Great. Okay, great. So yeah, so very quickly, because I know we only have a few minutes, but I want to go back to what my colleague mentioned around focusing on not just numbers, but on people. And I think that, these are real children we're talking about. These are real mothers, these are real families, and these are real impacts. And, we've done tremendous work in nutrition. We still have a long way to go. There are many challenges before us, but I think that we should also be able to recognize how much progress we have made. And I think when Dr. Bulbul showed the picture, sort of the earlier pictures and then the later pictures as Bangladesh rolled out its own nutrition program and the success that really shows in terms of progress, in these families, these children, these mothers, I think the more we can capture resilience and well-being of communities all around the world. I mean, we share these goals and we are all committed to achieving these goals together. So those stories and those success stories, I think, are vital in terms of really capturing the commitment and the interest of policymakers and legislators. Thanks.
I agree. I think stories have more power than numbers from our experience here talking to lawmakers as well. So next question to both of you. I think Dr. Bulbul can go first. How to engage the communities to maximize their access to utilization and benefits from the key nutrition interventions? I think this is more of community engagement. How do you engage that successfully?
Thank Thank you very much. This is really an important question, I think, because it's really important to engage the community people before going to start any programs. First of all, this might be obviously the context specific, number one. Number two is it really needed for the people what you want to do, actually want to have a project or any interventions, anything. So that is important. And finally is ownership. Community ownership is very important. Like if you start to do something for them, also you have to be make them owner of this part of programs or activities. So that might actually help them very much. Finally, but not the least, the important part is engaging the people, those who works in a program with the community people. So if there are any gap between these two groups, so there might be a chance of gap to have a better outcome or better results. So these three things is very much important to me to engage the community people or the community to any project or programs. Thank you very much.
Do you want to add, Hajar, from ACF perspective? I know ACF is good at community mobilization.
And I think one thing we found is, I think, connecting nutritional solutions to the larger community needs to work effectively in engaging communities. What we have done, for example, is that mother-to-mother support groups that were created as part of the behavior change and sensitization of nutrition issues. If we link up in terms of income generation activity, sometimes they use them as community voices, giving voice to the voiceless, in community engagement, and all this works effectively, because there is not only getting the nutritional services, but they get more engaged in the rest of the community. Thank you.
Yeah, thank you. Do you want to add, Kelly, or?
No, I'm not. In the interest of time, I wonder if you would like to do another question.
Sure. So I think one of the vulnerabilities COVID-19 exposed is lack of or weakness of local leadership. I will ask you, Kelly, about the role of new partnership initiative. How can this initiative be leveraged to ensure effective local leadership to integrate nutrition in health sector? If this initiative has resources to nutrition programming as well, just
yeah, so quickly, and we've touched upon this throughout the hour, that communities are really critical in solutions. In fact, the most critical in leading on solutions for their own communities. And USAID has, as I think folks are aware, the New Partners Initiative really looks to leverage local partners and their understanding and their innovation within their own communities. I'm happy to say that we are doing nutrition work under the New Partners Initiative, and even through our Advancing Nutrition project, we're seeking to partner with some local organizations to expand and scale up nutrition activities at the community level. So that's exciting work that we're undertaking, and we look to continue to grow those partnerships and identify new ways of working that will reach communities effectively.
Thank you. Okay, thank you all the panelists. I will just make a few points in our advocacy work here in DC, as we heard from all the panelists, and of course from a lot of other resources. All the evidence suggests that nutrition situation will get worse, but the response to this unprecedented need hasn't really matched so far. But nevertheless, we won't stop mobilizing. We will continue organizing, advocating, and engaging policymakers until we see better policy and increased financing. Along with all of you, I can confidently say that we are not ready to surrender to a world where more children die of malnutrition and hunger than will die in the pandemic. To date, the US Congress allocated a little more than $3 billion for international pandemic response. We were hoping the ongoing negotiation would have some results, but it seems more likely that we won't see a new COVID bill before election. But in terms of congressional support and our asks, there is really a strong support from Congress to those issues. In July, bipartisan groups of 32 senators and 125 representatives sent letters to congressional leadership in support of robust funding for U.S. global response to COVID-19. So that's really, considering the challenge here at home, also this is really encouraging that there is overwhelming support. Here, you know, in coalition with our partners, we are advocating for $20 billion for international COVID response in the next relief package, including $2 billion to address hunger and $500 million to address malnutrition. Our advocacy work is not only limited to a stimulus package. We are also urging Congress to allocate significant funding for global nutrition, health, and food security programs across various accounts in fiscal year 2021 regular appropriations, more investments through global health programs, global food security programs, as well as development assistance and international disaster assistance accounts. I just want to end in this note that everything we heard for the last hour, read elsewhere, demonstrates that perhaps advocacy work is arguably more important now than any other time before, and that we should continue pushing for more investments on maternal and child nutrition and for programs that could address root and underlying cause of malnutrition. I really appreciate everyone who joined us. I thank you, the panelists, for sharing your insights. The event is adjourned. Have a good day.
Thank you.
Thank you very much. It was really wonderful session. Thank you.
Thank you. Bye.